All right, we'll go ahead and get started. So welcome everyone. My name is Mina Napavi, and I'm a program director with the University of Alabama at Birmingham's School of Public Health's Office of Public Health Practice. I'm excited to welcome you to today's webinar, Understanding Avian Flu in Alabama, Impacts, Prevention, and Response, featuring Dr. Wes Stubblefield, District Medical Officer with the Alabama Department of Public Health covering the Northern and Northeastern districts, and Dr. Dee Jones, State Public Health Veterinarian, also with the Alabama Department of Public Health. This webinar is made possible by the School of Public Health at the University of Alabama at Birmingham and the Alabama Regional Center for Infection Prevention and Control, or ARC-IPC. The ARC-IPC was established to meet the consultation and support service needs surrounding infection prevention and control throughout the state of Alabama. The center is a collaborative effort of the Alabama Department of Public Health's Infectious Disease and Outbreaks Division and the University of Alabama at Birmingham. The ARC-IPC provides training and technical assistance to infection prevention and control and public health professionals in areas needed to detect, respond to, control, and prevent infectious disease outbreaks. You can learn more about the center, view and listen to past trainings, webinars, and podcasts, and view infection prevention and control resources at the website listed on the slide. You can also email arcipc@uab.edu with any questions. We would like to thank our co-sponsors for today's webinar, the Deep South Center for Occupational Health and Safety, the Alabama Statewide Area Health Education Centers, and the Alabama Public Health Training Network at the Alabama Department of Public Health, part of the Region 4 Public Health Training Center. You can learn more about their programs and these centers as a whole on the websites listed on this screen. Continuing education credits have been approved for nurses by the Deep South Center for Occupational Health and Safety for this program. In order to receive credit for this training, you must 1. Register for the training, 2. Watch the entire program, and 3. Complete the evaluation following the program. Upon completion of the evaluation, you will be redirected to the Alabama Nursing CEU request form, which you will also need to complete. CEUs will be awarded by the Deep South Center for Occupational Health and Safety. CE units for this program will expire on April 15th, 2026, and are only available to those watching live. And finally, it's my pleasure to introduce our speakers. Dr. Wes Stubblefield is a district medical officer with the Alabama Department of Public Health covering the Northern and Northeastern districts. Originally trained as a pediatrician, Dr. Stubblefield practiced general pediatrics for over 14 years before joining ADPH. While practicing pediatrics, he held leadership positions at local, regional, state, and national levels. He completed his MPH at UAB in 2018 and transitioned to a full-time public health role in 2021. Dr. Dee Jones is a 2001 graduate of the Auburn University School of Veterinary Medicine. He has been with the Alabama Department of Public Health since 2007. His focus has been primarily on rabies in Alabama, but he is also involved in response planning and control of emerging zoonotic infections in the state. Prior to joining ADPH, he served in the U.S. Army Veterinary Corps and has more recently worked with the U.S. Department of State with detection dogs. His professional interests continue to be veterinary public health, agriculture, and veterinary medical care. So Dr. Stubblefield, Dr. Jones, welcome. Thank you so much for being here. I will now pass things over to Dr. Stubblefield.
As background, we at Public Health have been involved with this particular virus for some time. Dr. Jones and I today will attempt to describe what ADPH is doing in response to this. As you know, knowing that we both have different backgrounds, this is a coordinated response across multiple agencies involving multiple people with different specialties in both the animal and human health worlds. And our goal is to tie those together today. But we'd also like to give you a brief understanding of what the disease is, what the virus is, and what it means for our future as Alabamians, and as people of the world. I'm not a vaccinologist or an immunologist, but in my role, I've been able to be a part of dozens of learning opportunities about H5N1, and I credit all of those experts from across the United States and across the world who study this, in coordination with agencies such as the FDA, the USDA, and CDC. neither of us have any conflicts with this presentation. So for our audience, it's always, to me, interesting to go back and think a little bit and just explain how we talk about influenza, because terminology is important. Many times you may hear different things, but if we don't all speak the same language, it's hard to communicate with each other. So let's talk a little bit about just the virus and the disease itself. So influenza has multiple different types, and it's further divided, and we'll talk about that, into subtypes. There are several different types of influenza, such as people have heard of influenza A, influenza B, but there's also C and D. The ones we think about most commonly are influenza A and B, and these are the ones that give us the seasonal epidemics. I was listening to some information from CDC today about what the vaccine efficacy was for this last year for compiled data for this influenza season. And what they said was that almost all of the circulating strains were influenza A. Only 3% of the tested strains were influenza B. So we had a very low B year. And these strains, these A and B strains, can change even during a year. But in the most recent vaccine, we had a trivalent vaccine, meaning we had 3 different strains. In the years prior to that, we had a quadrivalent vaccine, which means we had 4 strains, 2 A's and 2 B's. For this 24-25 season, we had 2 A's and 1 B, and this will be the same for the 25-26 season. And the reason we talk about those time ranges is because the influenza season generally stretches from around September to October until usually around March. And that's a good way to think of it. We have seen earlier peaks, like after H1N1 or with the H1N1 virus and either 08 or 09. And then we had some interesting peaks after COVID, where flu took a little bit of a different form. But in general, this explains, and if you look in Alabama, over the last few decades, influenza typically peaks right at the first of the year. And it's a little bit variable, but that's a good way to think of it. Now we talk about bird flu. You may hear different terms. You may hear avian flu, just another word for bird. You may hear people say AH5, so that means influenza A, H5. You may hear H5N1, which is more specific. And you may also hear the word HPAI, which means highly pathogenic avian influenza. And pathogenic means it's deadly. But what's important to remember is pathogenic means it's deadly to birds. It doesn't necessarily mean it's deadly to humans. It doesn't mean it doesn't infect humans and it hasn't hurt or killed humans. But what it means is it's highly infectious and highly contagious, but also highly deadly to birds. So highly pathogenic avian influenza. So those are some terms you may hear. Now again, influenza is then subdivided into subtypes using the 2 terms H and N. H is hemagglutinin. And this is the most important, probably the most important part of the way that influenza works, is that this is how the influenza virus binds to the cell so that it can get into the cell to use the cell's machinery to make more of itself and then replicate. So the hemagglutinin is very important. It binds to what are called sialic receptors. And this is where H5N1 is a little bit different. So H5N1 binds to the alpha-2, 3 sialic receptors, which are common in the upper respiratory tract in birds. And H5N1 binds to alpha-2, 6 in mammals, particularly in humans, which are more in the lower respiratory tract as opposed to the upper. And this explains to some degree why H5N1 does what it does. But we also know that alpha-2, 6 sialic receptors are prominent in the udder of dairy cows, and that becomes important later, and also in the conjunctiva of both humans and other animals. We also know that alpha-2, 6 is present in other mammals, and we know this because there have been many animal species that have been infected, to be confirmed to be infected with H5N1, not only dairy cows and humans. But it's important to remember that with epidemic influenza, the virus has to bind in the upper respiratory tract for it to be spread. So that's very, very important. And at this point, H5 has not gained that ability. It hasn't yet, but it might, but it hasn't yet. The next thing we talk about is N. So we've talked about H5N1. So N is neuraminidase, and this is a enzyme that cuts the virus away from the host after it's been made. And this is where the anti-influenza drug oseltamivir, also known as Tamiflu, works, is it inhibits that. So it inhibits the release of the virus from the host cell. And that also is why that oseltamivir has to be given very early in the course, because that replication is already happening, but it's we want to stop that release before the body has an ability to make an immune response, because that's what causes the illness. I was thinking about some other terms as well. So we think about different epidemiologic terms. You can see here the ones that I've picked out is we think about an outbreak, or a sudden increase in occurrences in excess of normal expectancy for a location or season. An epidemic, which is a unexpected increase in a specific area. A pandemic, again, thinking about pan, which means wide, covers a wide area, maybe several countries and populations. We have zoonotic diseases, so thinking about a pathogen that goes from a non-human to a human. And then an epizootic, which is a disease event in non-human animal populations, and it's like an epidemic in humans. And it's important to remember that influenza A, this what we're talking about, is both zoonotic and epizootic. So pandemic influenza in the past has so only certain subtypes of hemagglutinin have been known to document and infect humans, and you can see these listed here: 1, 2, 3, 5, 7. Pandemics have only generally been caused by H1, H2, and H3. Again, going back to infecting the upper respiratory tract and being able to be spread from one person to another. Another thing that's interesting about influenza is that influenza viruses in the same host can shift its genome around and create different viruses. And this is called antigenic shift. So it's reassorting itself. It can also drift, meaning it can change its antigen slightly and create a influenza virus that is not recognized by either a vaccine-induced immunity or an infection-induced immunity in the human, in the host. So there's different ways the influenza virus can evade the immune system. Specific to H5N1 and or HPAI, or highly pathogenic avian influenza, is that we know that this has been around for over 50 years. It has not always been HPAI, but we know that H5N1 HPI has been in circulation since the 1990s. It's also interesting that in previous outbreaks, or in crossover events, I should say, that these crossover events have been as high as a 50 to 60% mortality in infected humans. And the reason that is important is that the reason they think this is happening is because when the influenza infects the upper respiratory tract, the body has a chance to make an immune response. But if it makes it to the lower respiratory tract first, where those sialic receptors are located, then there's not a chance for the body to produce an immune response and can cause severe disease, pneumonia, and even death. This was thought to be introduced in the U.S. through migratory birds in the 2000s. The first documented death in North America in 2014. There are other viruses associated or labeled as HPAI viruses: H5N6, H6N8, and H5N9. And H5N9 being something recently as a reassortment virus that was detected in California in January of this year. This one is not thought to be any more concerned than H5N1 in the human population, but just something to note. And mammalian infection is unusual with this virus, but in this particular case, we have seen mammals being infected. In terms of human infections, we've been tracking this since 2024. There have been 70 human cases, and all of this information is available on CDC's website. Most of the cases have been in California, Washington, and Colorado. There are different clades of the virus. Clades are defined as a common ancestor, and then they're further divided into genotypes. These are the clades, and it's not important that you remember this, but I heard one presenter say that the D subtype means death. So D is not good. D 1.1 is generally associated with more severe disease. There has been no known human-to-human transmission at this point. The cases have generally been mild. There have been 2 patients with severe disease, and these were both with the D1.1 genotype of the H5N1 clade as noted above. There have been a U.S. death in an adult and a severely affected Canadian adolescent. The symptoms are primarily conjunctivitis. That means red eyes, with mild upper respiratory tract infection symptoms. And again, we know that the sialic receptors are present in the eyes. And we know that the people that have been infected have been exposed to large amounts of virus, either through milking operations, where we know that the virus is present in udders, because we know that the cows have it affects their milk and their udders. And then also that they have been associated with culling operations, with poultry culling operations, where large amounts of bird may be present. But we also know that there may be asymptomatic spread. And there was a study recently among veterinarians, and what they found is that there were veterinarians that had evidence of being infected or having antibody against H5N1, but were not noted to have ever been sick or did not self-report feeling sick. As we talked about before, these cases have generally had very direct high-risk contact with infected animals. And this is important when you think about epidemiologically. If you're in your clinics or in a healthcare setting, this is the question you're wanting to ask: is have you been associated or are you part of these operations? In Alabama, we don't have a tremendous amount of dairy operations. We have some, and I'm sure Dr. Jones will go into that, but we do have a large number of poultry operations. We talked about how the avian strain must attach to the receptors to form disease, and that those receptors are different among different species of animals. But we also know that this hemagglutinin has to attach to different proteins for it to become an epidemic or a pandemic. And so that's very important. And it's important that it's been around since the 1950s, and it hasn't done this yet. We also know that there have been other mammalian species, including domestic cats, rodents, and raccoons, among others. What's interesting is that some of the domestic cats had very severe disease, and there's some concern about whether or not this had to do with infected milk. However, but it's also known that when cats, and Dr. D may talk about this, but when cats drink, they put their face right in the milk, and so they also have an inoculum, that's coming right into their face. So what is CDC doing? So obviously CDC is very involved with H5N1. They are actively monitoring virus. They do take virus and map its genome to look to see if there are any changes that may be associated with more severe disease, either mutations that may make it more pathogenic, more transmissible, or potentially even resistant to oseltamivir, which is currently the treatment and or prevention. The threat to the general public health in the United States is continued to be felt to be low. And this can change at any time. This is updated on a regular basis. All the evidence are collected and evaluated, and it has continued to state this, and it's on their website. The CDC continues to work with other agencies, such as the U.S. Department of Agriculture and the FDA. Importantly, there are recommendations for treatment and exposures on the CDC's website, which constantly is being updated and monitored. Recommendations for personal protective equipment, whether this might be in different settings, and also for what happens with testing. We also know that the laboratory at CDC, as well as other laboratories, including our laboratory here in Alabama, can accept specimen not only from the nasopharynx, but also from the conjunctiva. And so these paired specimens may be helpful in diagnosing H5N1 in those that may be where it may be a concern. And you can see the website linked here for the CDC. So what is ADPH doing? So ADPH continues to meet regularly with the Agriculture Department. We meet regularly as internal leaders to discuss what is happening with H5 in our state, with those with their specific expertise in epidemiology, with animal health, with human health, and others. We're preparing for not only H5N1, but we're preparing for any high consequence infectious disease on a regular basis. We are constantly reviewing our plans for what it would look like if we had a sudden influx of a disease into Alabama that could be very serious for the population, and understanding what it would mean for us to transport those patients, have those patients seen in different settings, including the community setting, and where they would potentially be treated. And all of this is continues to be under development in our emergency preparedness division. But we're also thinking about what to notify healthcare providers in the public, or how to notify them. Most recently, it's been what we recommend is that if you have a patient in your office, the H5N1 virus should show up as an influenza A. If you're doing an antigen test in your office, or even if you're doing a molecular test that differentiates between A and B, it should show up as influenza A. So if you have a patient in the outpatient clinic who shows up as influenza A, and you ask them and they say that they are, for example, in a poultry operation, then that would be something where you might want to think about sending that sample on to be tested for H5N1. Now, if you're using another type of molecular test, one that differentiates different viruses, for example, there's many different commercial tests, but they run a panel of respiratory viruses. This might show up as a novel virus or a non-H1, non-H3 virus. And that would be another case where you might think about this. But it's also been recommended by CDC that with all hospitalized patients that test positive for influenza A, that those samples are sent and expedited to public health laboratories to be tested, thinking that those might be a better way to pick up H5N1. And so this is part of CDC's national collection system where we're monitoring H5N1 disease. It's also important that everyone realize that backyard flocks can be infected and can be affected, and that it's very important to report dead birds or multiple dead birds to the Department of Agriculture. And those information is on the website, on Alabama Department of Agriculture's website, about where to report for both operations, commercial operations, but also for backyard flocks. And then finally, what we've been telling individuals is that we know that pasteurization does inactivate the virus. And you can still find particles in the virus, but they're not infectious. There's not been a study yet that has shown that you can take culturable virus or live virus from pasteurized milk or other animal tissues like meat. But we know that if the animal tissues are cooked to the recommended temperature by USDA, or if they're pasteurized, there are no culturable virus in those samples. So as of right now, it's recommended for people to not drink unpasteurized or raw milk. And this is in addition to the other diseases that can come from raw milk, such as Salmonella, E. coli, and Campylobacter. So in general, not a good idea, but specifically with H5N1 until we have more information. Although the contents of the stomach may inactivate the virus, it's not worth the chance. And then you can see our website here at Alabama Public Health. So in prevention, there is a vaccine. There's a vaccine that's been in development for some time. It is not specifically matched to the current clade, although it is felt that there may be cross-reactivity. Have not been particularly studied, but it is felt that it's possible. There is no licensed vaccine commercially in the U.S. There are millions of doses in the Strategic National Stockpile. So if this became a pandemic, it is possible that they could release those viruses until other vaccines could be made. Finally, in some European countries, they are actively vaccinating some dairy and poultry workers, but that is not happening in the U.S. yet. Now, there's also something called a candidate vaccine virus that's available from CDC that's been distributed to manufacturers that can be put into production very quickly. And the manufacturers have that virus, a candidate virus, and that's monitored by CDC to look for any updates. And then finally, if we are called upon to deliver vaccine in the case of a epidemic or pandemic, of course we'll respond as needed. And then finally, we think about this cross-sectional response, so what the WHO calls One Health response, and how important it is that we work together because all humans and animals are interconnected in our world of nature. So I'll pass this off to Dr. Jones.
Good to have the opportunity to discuss, this emergence of HPAI, because it's had an impact not only on public health, but also animal health, wildlife, and not to even mention the agricultural impacts, economic potential impacts for Alabama. So for the past 12 to 15 months, we've been extensively involved with other state and federal agencies to develop a response plan that will ultimately, with hopes to decrease human exposure and human infections. And, in my estimation, it's not a lot different from other public health emergencies or emergence that we have done over the last decade, and lots of similarities. And as Dr. Stubblefield mentioned, it involves a one health concept in order to have a robust response that is all encompassing. We have animal health, human health, environmental health. So that's something I think you'll see going forward more and more as this one health approach. And for a long time, we use that term. I think it's actually starting to come into practice. We're using it more than we're talking about it. So one of the other challenges of developing a response is different perceptions based on what different people's perspectives are. And I'll give you just a very quick detail of one instance that I talked to a lady that was very concerned, very adamant that her city council should not approve for people to own backyard chickens, for fear that that was going to be the spread of avian influenza. And then if you contrast that to the dairy producers early on in this outbreak, and we'll get to that in a second, but they were very adamant. They were asked to submit samples of their milk for surveillance, looking for the virus and where it would be located. They were very adamant. Alabama producers were very adamant that they were opposed to that, and understandable that that was their livelihood. So they, in a sense, they were saying, hey, if it's here, we don't want to know about it. So those are all just kind of facets of developing any response that you kind of have to work through. So kind of turning to the slides here, an overview of what I would like to talk about, and there will be some overlap as Dr. Stubblefield so eloquently described it. I hope to give a little bit more of an animal perspective, but we'll talk about the current situation with HPAI, and I'd like to talk about how we got here. Almost as if sometimes I think back, well, did we just throw a dart on the target? If you ask us in 2022, hey, cows are going to have avian influenza, that really wasn't on anybody's radar, or was it? It certainly wasn't on ours. And then I want to talk about a few specific things that we do at ADPH. So I'd like to credit CDC with their website has done a wonderful job. And Dr. Stubblefield mentioned this clade we're dealing with. Inside of this clade, it helps me for understanding, inside of this clade are a few different genotypes. And but essentially, an overall view is these genotypes, the current situation, these genotypes have sort of have evolved to become more adept at infecting mammals. So essentially, this transition of being concerned about bird flu staying in birds, through these changes, these genetic changes, we've now seen the adaptation to infect mammals. And with that, overall arching, we know that the more mammals that are infected become more of a risk to human health. Ultimately, we're most concerned, as Dr. Stubblefield mentioned, about human-to-human transmission. So all of the cases we've had so far have involved human to animal contact with infected animals. So here's a few snippets. Headlines in March and probably before March, but before we really knew what was going on, avian influenza type A H5N1 in dairy cattle originated out of Texas, and we'll get to that shortly. But then soon to follow, other species over on the right, goats confirmed to have highly pathogenic avian influenza, a pig in Oregon, and our pets have always been a concern. I've not really gotten a lot of information about dogs, at least the severity of the disease in dogs, but cats. Cats have historically been susceptible to avian influenza in general. And these poor cats, they can't win. So a variety of ways to be infected. So if cats didn't get it from wild birds, they were very important in our what we call peri-domestic species being infected as it related to the dairy herds in Texas and in the Midwest as the dairy outbreak spread. And then thirdly, this thought process, a lot of people view pet food as raw being better. It's a healthier choice. And we'll get to that too in terms of what the human aspects to sort of delve into that dark side, so to speak. But so all three of those pose a risk to cats. Again, from the CDC website, I just wanted to share this. It's been very helpful in a way to kind of keep a scoreboard, if you will, about the number of animals infected. They do a wonderful job on keeping it up to date. Look at some of these numbers, close to 13,000 wild birds, 170 million poultry, 1,000 dairy herds over 17 states. 70 human cases is what that reflects, and that one death. Now, there was some mention earlier about backyard chickens. Well, that one death, although there is an asterisk beside that, there was a backyard chicken exposure. Now, there's been some debate as to how significant that was with existing comorbidities as terms of the exact cause of death. So we talked about this transition of an avian influenza where we used to have the comfort of thinking, hey, avian influenza in birds, and that it's one problem to think about that being spread to other birds. But as we talk about our condition now, we're talking about mammals being infected with HPAI. And I'll just read some of these cats kind of at the top of the list. A domestic cat, a bear, a dog, a marine mammal, a mustelid, a lagomorph, a raccoon, a rodent, a skunk, and a possum. And if you kind of look at the spatial organization here of these positive cases, look how it matches up with the flyways of wild birds. So we have to remember this is circulating in wild birds, and the risk of transmission to these mammals based on the flyways seems to match up pretty well. A couple of diagrams there that illustrate the major migratory pathways of birds. So if we look at HPAI in Alabama and wild birds, and thanks to the USDA, we mentioned cooperation. So this is truly a One Health, lots of cooperators, federal and state. The USDA Wildlife Services does a good job of collecting wild birds. There's a couple different ways they do it, but we've had 107, at least at the time of this snapshot, cases in Alabama. And then if you look just to the right of that, the implications of those wild birds, every blue dot that you see here on the state map of Alabama indicates a commercial poultry flock. So the concentration and really just the robustness of how many per commercial poultry flocks in the state of Alabama. In fact, it's the major agriculture commodity, 65% of annual farming revenue from a state perspective. So this screen, the picture on the right with the red dots indicates one I borrowed from the agriculture department, Ag and Industries, and that's their response to circulating virus when one of these pops positive with really any avian influenza virus, H5, H7. So don't fall into the trap of just thinking it's about H5N1. Yes, that's the main concern at this point, but there's routine surveillance that goes on in the poultry, commercial poultry operations, and there's a lot of it. But when one of those tests positive, there's the response plan to minimize the impact, which is very difficult because if you look at the concentration of these poultry farms, but they'll come out, the depopulation of a certain area in a radius, and then it expands out. And then once all of those additional testing, they ramp up the testing to make sure that there's no residual virus being transmitted from birds to bird before calling the outbreak over. So hopefully I've painted a picture here of an avian influenza that we would like to say it's contained in birds, but the fact is it's not, and has raised some questions of, well, why all the mammals? Why are mammals suddenly being infected? Why is there seem to be more risk to animals than to mammals than there has been historically? So, and then I think the other questions that we're dealing with in this situation where we've had impacts on the food supply that we're not used to. So a lot of people like to consume raw dairy. Not many people like to eat raw meat, maybe on accident, of course, but I think that concerns more of our pet owner population. But what are the impacts on the food supply? And Dr. Stubblefield covered low path and high path. The tendency, I think, misconception about high path being more dangerous. Certainly it's not. And we know low path avian influenza plays a very important part, at least genetically, in contributing to strains that can infect humans. So if we take a historical look back, 2020 was kind of a year, and I guess probably no one on this call would miss what was going on in 2020 if we were talking about something other than avian influenza. But looking back on it, 2020, things were happening that I would say not many people in public health channels knew about, but we talked about the reassortment of viruses and avian influenza H5 and N6, H5N8 actually reassorted in Asia, I believe, but and it reassorted in domestic poultry. So we had a wild bird virus that infected domestic poultry, reassorted, and out of that came an H5N1 novel genotype. And that's the clade we're talking about, H5 2.3.4.4b. Well, these wild birds, so the domesticated poultry, the theory is that it was spread back to wild birds. Then this new virus, this novel genotype, was spread back to wild birds, and that began the cascade of events for the spread across Europe into Africa, the Middle East, and Asia. Now, I want to paint the picture that we had virus circulating, not just H5N1, but particularly a novel type H5N1, and it seemed to have a greater propensity to infect mammals. And I put COVID there because what was going on in 2020? COVID. All the attention was on COVID. So here's a reference. I'll read some of this to you. This virus clade underwent an explosive geographic expansion in 2021 among wild birds and domestic poultry across Asia, Europe, and Africa. By the end of 2021, it was detected in North America. And then that wasn't quite the end either. I think if you read here, it continued to reassort with viruses currently circulating in wild birds in North America. So that's one thing we deal with, is that reassortment didn't stop and is not likely to stop either. Now, the next few slides, I will just really demonstrate, certainly not an all-encompassing mammalian infections, but really want to demonstrate just a timeline of things that we were seeing. Foxes in the Netherlands were positive, press releases on that, papers on that. And in 2021 to 2022, HPAI-H5 became the predominant virus, really circulating, causing poultry outbreaks across the globe, major commercial impacts in infecting poultry operations. Again, wild birds to domesticated birds. Actually, it was first identified in this particular clade was first identified in January of 2022 in wild birds in the U.S. So just a quick reminder, we have covered avian influenza is not just H5N1. Early in the 2021-2022, multiple human cases of avian influenza other than H5 and H5N1. And here's low path avian influenza. So sort of a take home message there. H5N1 circulation. By January 2022, the first human case, at least I think, was an Englishman that raised ducks. So this particular viral clade H5N1 seen in an Englishman in raising ducks. February, the next month, a large turkey outbreak. And I don't know if you guys remember, I vividly remember the talk of, will there be enough turkeys for Thanksgiving? So that doesn't seem like it's been 3 years, but it certainly has. And then, of course, in April, we had the first human case. There's some discussion whether that was a true infection or a nasal contaminant, because that person was working in a poultry facility that was positive. So I just want to put this slide up because a lot of people may not know what the commercial poultry industry looks like in Alabama. Look at the size of these houses, very robust, very long. Volume, there can be anywhere from 50 to 60,000 birds, depending on the bird size in any one of these houses. And 5 to 6 houses is fairly common on the average production facility in Alabama. I would like to just point out that, you know, the human risk at this point is really people involved in these industries. So if you just take a person off the street, the risk of avian influenza, much less than if you take someone responding, what we call ag first responders, or that whole depopulation process in order to prevent the spread in chickens, are putting people, and particularly first responders and veterinarians, at risk. So then fast forward a couple of years, and beginning early last year, that dart, so to speak, like avian influenza infecting cows. What? You know, it was kind of like our response of, I had to check myself. Okay, where were steps A, B, and C? Because I hadn't really put this picture together beforehand. But in the Texas Panhandle, there were several cows, probably dating back to late 2023, if not January 2024. But cows that were becoming sick, it was a high morbidity, but a very low mortality. So one of the more common things that dairy cows, we assess health of a dairy cow is the amount of milk that it's producing. And we saw that milk production go way down. So even though it wasn't killing the cows as it does in poultry, chickens infected with HPAI will die, and die really in a matter of hours, if minutes, if not hours, and not much into days. But this was a different process in the cattle. So it was raising questions. We now had, and as we talked earlier about the receptors, the milk was teeming. The milk was teeming with avian influenza. So now we have species that we can't cook that out, right? We can't cook that virus out. And one of our main messages has always been with avian influenza, hey, the meat is fine. Well, for one thing, those chickens aren't living. So the chance of eating a chicken with avian influenza is pretty small, especially high path avian influenza. The chance of drinking milk, if you don't pasteurize it, from a cow infected with HPAI is much more increased. So some of those nuances were different on cow infections. So the genotype we were talking about is B3.13, and it was isolated. What is thought to have come from a single source input from wild birds into a dairy, and it infected cows, and it quickly spread to infect other cows. And then, as we mentioned, hey, these cats are getting sick on some of these dairies. So we started to appreciate these peridomestic infections, and lo and behold, humans were also getting sick. Well, what conjunctivitis mainly, but that was the first complaint. And they had a direct association with the dairy itself. So in the agricultural community, there was a federal order put out we knew these cows were giving it to other cows, a federal order to stop the interstate travel. Looking back, some thought processes of, well, was that done quickly enough? But nonetheless, it ended up being widespread in dairy cows in 17 states. Just to hit on mutations a little bit, like why is it maybe just more important that cows are becoming infected? Or why is it more important that mammals in general are becoming infected? Because changes that will happen within those mammals, within those mammalian species, there's evidence to suggest, hey, that's more likely to present a risk to humans. And ultimately, our main concern is human-to-human transmission. So we talked a little bit about dairy industry, and if you compare this to the Alabama dairy industry, at least, it pales in comparison to the poultry industry. We really only have 16 to 18 grade A dairies in Alabama, and the Alabama Department of Public Health is responsible for permitting those dairies. So that what that did is it put us in a unique situation of being able to help the Department of Agriculture when they were being tasked federally to come up with a plan to assess and do surveillance to make sure how prevalent is it in the dairy cows. It put us in a unique position to help out. And we'll get into this, our regular surveillance and monitoring. So we're not actually testing the milk for HPAI. That is a Department of Agriculture function. However, we do assist in collecting those samples because we have routinely gone to these dairies and collected the samples anyway. Okay, so we, as an agency, we are monitoring for a period of 10 days poultry workers, and we like to have oversight of if anybody with exposure to poultry and our plans for dairy noted we've not had any dairy positives. If any of those people become symptomatic after being involved in any agricultural function, whether it be a depopulation or farming, we want to have oversight of really how and where they're treated. We've partnered with the ag and industries to develop a complete surveillance plan, or a comprehensive surveillance plan, at least for the dairy industry. And that was the new one. So that already exists, really, truly already exists for the poultry commercial side. But the new one has developed for the dairy. Wild bird collections are usually done with the USDA. Occasionally we get phone calls. The state DCNR, Natural Resources, the state wildlife, very important in helping us sometimes collect wild birds, and then those would be transported to the veterinary lab for testing. One important upcoming event will be a tabletop exercise with state and federal partners to hopefully kind of go over everything that this response encompasses, and have a bit of a role play, if you will, and just look for gaps in our planning to how can we best protect people. Very quickly, I know I'm running out of time, but so the ADPH does permit those dairies, everything from farm to the facilities, processing facilities, onto the customer. And that milk testing is done at one of two of our BCL labs. This here is in Prattville. And realizing that the people at most risk at this point are the people directly involved in agriculture or the veterinary response to the disease. So our outreach has tried to highlight and target those specific populations of people, not to leave out backyard chickens. So just a couple take-home thoughts. Avian influenza viruses, it's more than H5N1, right? That's what we're talking about right now. That's always subject to change. Even H5N1 could change within H5N1, or we may be talking about something different next year. And it's primarily an animal disease right now, with the health department's main task is assisting in surveillance. The peri-domesticated species are just really an indicator that, hey, we now see mammalian infections. Does that mean human health is closer to being impacted because of these peri-domestic positives? Okay, guys, and then we'd also like to, we're looking at ways to improve our capacity, and Dr. Stubblefield talked about that. But one thing you'll see sometimes now is wastewater surveillance, and looking at novel ways to detect novel influenza viruses. Okay, that's all I have. Thank you.
Thank you so much, Dr. Jones. Dr. Stubblefield, hopefully we have time for a couple of questions. One for you, Dr. Jones. Someone asked, how can we protect outside cat colonies against these outbreaks?
Well, that's pretty tough. I mean, I think that's certainly not one of the high up on the totem pole of concerns when we talk about infecting people, but it is very tough to protect a cat. I mean, obviously we would like for our wild birds to give us some indicator of where the virus is circulating, but yeah, there's no vaccine. So, at this point though, however, the majority of cat infections across the United States have come from either feeding, from human involvement, either feeding raw meat or ingesting on these farm cats, ingesting raw milk.
And another follow-up question for you, Dr. Jones. To clarify, does USDA recommend vaccination of dairy cattle just as recommended for humans?
Well, I mean, we throw out the word recommend. I think the best word to use is exploring. There is no such vaccine for cattle. There's no such vaccine for poultry at this point. And a lot of factors go into determining whether or not there will be a vaccine, or I think certainly there could be, but then you have factors of economic impacts that deal with trade, uh, um, and other impacts that deal with, well, how do we facilitate vaccinating all of these chickens? And certainly that's not worked out. That's not the current I guess the current working frame of responding to these viral infections.
Dr. Stubblefield, this question may be for you. Can avian influenza be detected in wastewater from agricultural runoff like other infectious diseases? And if so, is this being monitored at the national or state level, or is surveillance mainly coming from farmers reporting cases?
So Dr. Jones may be better at this.
Okay.
I know that if you go to CDC, there are sites that are monitoring for H5, and you can find that on CDC's National Wastewater Surveillance System. And you can actually look at a map where these surveillance sites are. There are sites, according to CDC, sites that are detecting or that are monitoring but have not detected any in the last week. And there have been detections in the U.S., only 4 detections or 4 sites in the U.S. from time period March 30 to April 5. So I would encourage people to go to the NWSS system at CDC to explore a little bit more about that.
One last question. How is ADPH responding to the misinformation about health benefits of drinking raw milk?
So, primarily we focus on what we've always focused on is that raw milk, pasteurization is one of the sort of the most brilliant things that has happened in the last 100 or 200 years, that you can maintain the protein structure and the taste of milk by heating it very briefly to a high temperature that inactivates almost every organism in the liquid. And we've known this for a long time, that raw milk can and it has caused human disease from many different pathogens, one of which could be H5N1. So as we go forward, until we know more information, the general public should be discouraged from drinking raw milk because of those bacterial and other diseases, and potentially in being infected with H5N1. Do you have anything else, Dr. Jones?
No, yes, we are adamantly opposed to the consumption of raw and undercooked products, even from an animal perspective too. So.
Perfect. Well, I know we're at the top of the hour. So Dr. Stubblefield, Dr. Jones, thank you so much for taking time out to cover this important and very timely topic. And for those listening and watching, thank you so much for joining. I hope you have a great rest of the day.
Thanks, everyone.